My name is Phil Perazio, and I'm a urologic oncologist, a surgeon. Like many of you, I absolutely love what I do, and I would not choose another profession. But I have struggled with professional identity, practice efficiency, and wellness over the years. Operate with Zen is a podcast designed to explore a mindful approach to surgery and to being a surgeon. By discussing these struggles and mindful solutions, I hope together we can create a community of strong and healthy surgeons. Enjoy. Welcome to this episode of Operate with Zen. Today, I have the great pleasure of being joined by Chris Jaeger. Chris, introduce yourself to the audience.
Thank you for having me, Phil. My name is Chris Jaeger, and I'm a proud Michigander who's married to a wonderful wife named Kat. But I guess professionally, I am entering in my third year of a pediatric urology fellowship at Boston Children's Hospital, and I'm a proud graduate of Ohio State's residency program.
Yeah, so we had the great pleasure of meeting at the AUA, American Urological Association meeting, where we were both on a resident panel for wellness. And it was a great conversation and some really great topics. But, one of the reasons you were there is for this wellness initiative you started at Ohio State. So if you don't mind, let's start there. Tell us a little bit about what brought you into a wellness initiative at Ohio State and what you learned.
Yeah, so, at Ohio State, I have my own personal journey through wellness, but I think, myself and some of the other core education faculty, namely Dr. Lee, Dr. Post, and Dr. Bellows, we're really taking note of the burnout that some of the residents in our program were experiencing, but also the phenomenon that was kind of sweeping all of medical specialties and especially urology in the literature. And we wanted to do something about it. And, we didn't want to just kind of say that it was happening and hope that some other entity or the system was going to take care of itself. We wanted to try to do something about it. But we also didn't want to just do something offhand without paying attention to the literature and trying to do it as scientifically as possible, if that means something. And so yeah, we essentially took note of what others had done in the past, both in urology and outside of urology, in surgery and outside of surgery, mainly focused toward residents. And we try to compile it into a curriculum that we piloted. And we wanted to measure its effect as best we could on burnout in particular, but also stress and satisfaction with life before and after.
That's great. So let's start with some basics. I mean, how do you think about or define wellness? What does that mean to you? And there's lots of ways to define this. So I'm, just curious on your thoughts.
For me, I think wellness equates with general health and satisfaction with life and satisfaction with job. I don't actually ascribe to one particular definition for other people, but for myself, that's what that means. And I think that our curriculum and our pilot program really reflected that. We can go into details, but essentially we didn't want to create a one size fits all. We wanted to offer as many ways to get to wellness as possible, depending on your own definition. That could be something in the mindfulness category, that could be something in more of the physical health category. So to me, wellness is much more in the sense of mental health. But for others, it may be something completely different. So,
yeah, I think that's a great point. People ask me all the time, they say, all right, Phil, what's your routine? And I say, okay, well, this is my routine, but I can guarantee you that's not going to work for you, right? We've all got to find what works for us and be intentional, be purposeful about how we move through wellness and what that means for us. And I agree with you. There's definitely a strong mental component, mental health component. For me, I found a huge physical health component. And, you're a little younger than I am. You may see as you spend more and more time in the operating room, you don't feel as good as you used to. And, the wanting to physically feel well at work has been a big driver in my kind of wellness journey, especially over the last few years. So yeah, so let's talk a little bit about the program. How did you expand it out, and what were the different components that you allowed people to individualize into?
Yeah. So we started with a big literature review just to see what others had done, and we found that these wellness strategies at particular programs, we call them domains, and they really encompass 6 domains, and those were nutrition, fitness, sleep, mindfulness, positivity, and work-life balance. Also, some would prefer to call it work-life integration. And we basically defined 2 activities within each of those domains that residents could try. And these were linked with prior successes that others had demonstrated with published research. And what we did was we wanted everybody to try it in the first part of the pilot. So we did a 24-week pilot. In the first 12 weeks, we asked every resident who was willing to comply with this voluntary pilot program to try at least one activity within each domain over the first 12 weeks. And in the second 12 weeks, knowing their experiences in the first 12 weeks, we asked them to choose at least one activity in a domain that they liked, that they found was helpful. So really ascribing to the notion that one size does not fit all, and that, some would prefer one domain or maybe a set of domains, and others would prefer something completely different. And, we measured as close to an effect as we can with this, imperfect, non-randomized trial with validated measures before and after. And we also measure compliance throughout.
That's great. So give us examples, if you don't mind, in each of those domains: nutrition, fitness, sleep, mindfulness, positivity, balance. What's something you could have done in each one of those, just so people understand?
Yeah, absolutely. Yeah, these aren't novel things. I don't want to say that they're novel by any means, and that'll come out. So nutrition, one activity was eat 3 balanced meals per day. Another one was to avoid a vice, such as alcohol, simple sugars. These things that can certainly affect how we feel, but how we think as well. For fitness, 10 minutes of moderate activity, or organize a team activity or sport after work. Sleep was get at least 7 hours of sleep, and try to practice good sleep hygiene by staying away from devices at night if possible, if you weren't on call. We can go through another couple examples. One in the positivity realm was actually have a meaningful conversation with a spouse or a friend. And then for work-life integration, we actually found a number of people chose this activity. One of the activities was to actually organize or attend a social activity. And what we found as a result of this pilot program was that our residency program suddenly had a ton of communal meals and activities to do. So, there are people who would obviously choose, one of those activities over another based upon their personality and what works for them. But we really tried to not make it onerous, and to allow people to do very, very simple things, but also meaningful things.
Yeah, I think it's beautiful, and you're not giving yourself enough credit, right? There are very few, truly original things, but what's original here is kind of putting this together in a very digestible way for surgeons and for trainees. And I think it highlights some really important things. First is everybody's going to have different needs in different domains. And not only that, those are going to evolve with time. So your needs during training may be different than your needs during fellowship, may be different than your needs as faculty. And we'll talk about that because you're going through some unique transitions too. But I think, one of the other important things that this highlights is how much we crave interaction in the hospital, right? The people we work with, particularly in our subspecialties in our fields, we have a lot of similarities and a lot of things that bring us together, but we don't often spend time cultivating those. And I think the fact that your residents and your co-residents showed that they wanted to spend time together is hugely impactful, just saying how strong community is, but that's also an incredibly mindful way to approach kind of the struggles we go through and wellness. Right? It's a way to be present. It's a way to be present with other people and really engage with them. And I think that's just an incredible observation in itself.
Thank you for saying that. And I couldn't agree with you more. I think that the community aspect, especially in urology, I think a lot of us got into urology in large part due to how it differentiated from maybe general surgery, at least in my instance, in the community aspect. So I think really leaning into that, we found success in that. Absolutely.
Yeah. And I think the other really important part of this too is you provided people with really foundational information. Most people don't know what good sleep hygiene entails. And I also love that it wasn't 8 hours or 10 hours. 7 hours is reasonable. And everybody's going to find their different sleep pattern too. I mean, to be honest with you, I'm happy at 6 hours. I'm highly functional at that, but I do strive for longer when I can. But getting the devices away, people don't understand how actually detrimental that can be. And just giving people the basic foundations of good nutrition, good sleep hygiene, short amounts of physical exercise can make huge benefits in your overall wellness.
Yeah, couldn't agree more. And I think, even in the instance that, people have heard these things before, I think actually putting them on paper and, challenging in a polite, voluntary way to ask them to try to practice these good habits can go a long way.
Yeah, and the point that brings up, I encourage people to get stakeholders. You created a stakeholder model, right? By being involved in a study, there was a stakeholder who was involved in every single resident's well-being, and that's huge. And I give you a lot of credit for kind of pushing this through. Tell us a little bit of. I know your paper's not published yet, but tell us a little bit, if you don't mind sharing, kind of some of the outcomes and what you guys noticed over 12 weeks and 24 weeks.
Yeah, so I think one important outcome is compliance, just to see if this is even feasible to do. And we thankfully had good compliance, not perfect, but about 3/4 of our residents participated in this voluntary program, which was I was pleased by. And we found that those who did comply with the program, over time, they engaged in more good habits than bad habits. So what I mean by that is, everybody has got good and bad habits that they do. And, this can be measured on validated questionnaires. And what we noticed over time was that those who complied with the program did more good habits and less bad habits, which was great. Our primary outcome was burnout. And we noticed a 26% decrease in burnout on validated measures pre-post. We did notice a 18% decrease in stress and 21% increase in satisfaction with life. Obviously with our study design, this can't be directly attributable to this pilot program. We know that, but we did see measurable increases in these three important measurements. We did notice, actually, interestingly, that these positive effects that I described were more pronounced for senior residents than they were for junior residents. We also found that no one of these wellness domains that we had talked about were better or worse than the other. And then overall, the residents were quite satisfied with the program and the ability to choose their own approach. So all in all, I think it was a success. And we know that it was a pilot program. It was always designed that way. So we have since expanded it. Well, since I left, Ohio State has expanded it to the faculty cohort, and it's actually expanded beyond the Department of Urology. It kind of caught fire within the Ohio State universe, and other departments have actually embodied some aspect of this wellness curriculum for their program. So long story short, good success, not perfect, but hopefully coming to a journal near you.
Yeah, that's incredible. And I think it speaks to the need for this and the desire for people to kind of pursue wellness. I think, just what I'm most interested to see now that you mentioned this, the senior resident, junior resident, how it parses out with the faculty as well. As we think more about wellness curricula and incorporating this into how we train surgeons, it might help us identify what we should be targeting for juniors versus senior residents versus junior faculty versus senior faculty, because we do have different needs and different professional development needs as we progress through our careers. And I think that's could be some incredibly valuable information, Chris.
Absolutely. Absolutely. We did have some important lessons learned, though. I think it's true for any program. I think one of the most important lessons was to have a champion for this program within the resident cohort. I think myself and others were filled that role, but I think without that, I think the program would have fell short. And then also, like, we realized that, I told you about some of the activities that we prescribed, but people wanted more. Actually, 2 activities wasn't necessarily enough. It didn't speak to everybody the same way. So we have since, like, expanded the number of activities and provided even more resources if people want to delve down that road. They don't have to click on all the links and go to all these different resources, but they can.
Okay. Anybody sign up for mindfulness?
Yes, everybody tried mindfulness, and our mindfulness activities were download or use a meditation app or follow a meditation guide for 10 minutes a day, or engage in narrative medicine, which is something that yourself, I know, engages in quite readily, but I imagine a lot of urologists don't. Maybe I'm wrong about that,
Yeah.
but at least those who went through our program have tried it.
Yeah, no, I'm just curious, always curious what other people are thinking out there. Any big failures, anything you would have noticed that in retrospect you would have done differently, or people that you had a really hard time engaging with?
I wouldn't say an overt failure. I think the most common complaint we got was from faculty. They were like, "What about us?" And I heard that probably 1,000 times, and I didn't have a good answer, other than to say that I'm a resident, and we wanted to tackle what we thought were the most vulnerable people, but that may not be true. I think that could just be a bias, and I think not incorporating faculty, it may not be a failure, but I do think it's something that is vitally important when we talk about wellness. It's not one population that affects. It affects, well, burnout affects everybody, and wellness is important to everybody. Maybe completely different domains that are important for junior residents, senior residents, faculty, etc. But omitting them from these programs in retrospect was not the best idea.
And I think it's very honest of you to say. I think if you, I've become very interested in junior faculty, and some of that's through my personal wellness journey and story, and thinking about the struggles that I had as a junior faculty member, but seeing that is an area that is not well addressed, right? Residents have program directors, and they have program coordinators, and they have people who check in on them on a regular basis. And the ACGME is basically a governing body to make sure that residents are okay. People who progress through senior levels of faculty development may have coaches or kind of professional development courses, but really when you start in your career, you're kind of left to figure out a lot of things on your own. And I think we can do a better job there. And I think you highlight that there are some interventions that we could provide to early career people to really help them out. And so I think, once again, a really important point that you're now providing data for, right? We think these things, but data is hugely important in our field and others.
Couldn't agree more. Couldn't agree more. And I think, I've heard of various, I'm not a faculty member myself, but I've heard of various strategies to try to coach or to help transition junior faculty into those roles. But it's something that causes quite a bit of anxiety for myself looking to that transition in the next year or so.
Yeah, and I want to talk about that. But before we get there, let me ask you, how did this tie into your personal wellness story? You kind of alluded to it before. So, where were you when you started this program, and where did it help you get to, if that's the appropriate question?
Yeah, my personal journey with burnout and wellness is it was a tough one. My personal journey with wellness is ongoing. I'll be the first to admit that I have not figured it all out. And I'm constantly growing. And I'm on the cusp of my clinical year in my pediatric urology fellowship. So I'll definitely need to practice some good strategies coming up. But, in residency, Ohio State was going through a number of transitions when I was a young resident there. And the morale of the entire department was low. Yet the patients kept flowing. And a lot of residents were feeling very extended and burned out. But in my personal experience with this, I noticed that I was interrupting patients. I noticed that I was even in certain instances showing a significant lack of empathy toward the patient experience. Still doing my job to satisfaction, still progressing in my learning objectives, but was not really there. And this was completely out of character for me, and it was something that I noticed in myself. And when I kind of took stock of things and took a step back, I realized that, I was going to work and I wasn't really doing anything healthy for myself. I was essentially going to work, working very hard and coming home to, either pour a drink, to decompress in front of a TV and not talk to my wife, to not eating healthy, eating fast food whenever available, and falling asleep and doing it all over again the next day. And it was like this vicious cycle of continuing to do that and practice unhealthy habits. And I noticed that in myself. And how did I get out of it? I had tremendous support from my wife. But to be honest with you, I got out of it by kind of like leaning into what it is to be like a physician, if that makes any sense. And I watched a lot of I watched my mentor with patients, who is a urologic oncologist at Ohio State. I watched him really lean into the essence of patient care, and he was one of those faculty who really embraces humanity. And I kind of wanted to model his behavior, and I realized in order to do that, I needed to be a healthier version of myself. And that's when I really tried to look into what strategies I could employ to basically be more present myself, take care of myself first. And that's where I fell into diving into wellness. And that was honestly the precipice for this wellness curriculum.
That's great. And thank you for being so honest. And, I'll tell you, my personal story is similar, but I wish I had recognized it when I was a resident and in training. I didn't realize I was burnt out till a few years into faculty, and was able retrospectively to look back and say, man, I've been cycling in and out of burnout since I was an intern, basically, maybe even in med school. And I think recognizing when you're acting out of character, when you sit there and you go, I just yelled at an ER resident, or I was really rude to a nurse. Would you normally be rude to people? I don't think so. I don't think most of us would be. And we don't do it because we're bad people. We do it because we're burnt out and we've lost all of our kind of emotional reservoir and our ability to kind of function at normal human levels. And that's what made me realize, is sit there and go, that's not who I am. I've been acting like a complete moron, and I need to make some real adjustments. And I think, I give you a whole bunch of credit for recognizing that as a trainee. And I give credit to your program for fostering that as well, too.
Yeah. Well, thank you for saying that.
Yeah. And I'd like to highlight this because, I talk to a lot of trainees now. I talk to fellows and residents. And one of the big criticisms of kind of this mindfulness wellness movement is, we're residents, we have no control over our schedule, or very little control of our schedule. How the hell are we supposed to focus on wellness? How are we supposed to work on nutrition and diet and sleep when, I'm at the whim of the OR schedule and the faculty's day? So, I think it's important to highlight that you did it. And so tell us a little bit about how you made those adjustments, how you fitted in to a resident schedule, to a trainee schedule, because I think it's an important lesson for people to hear.
Yeah, I think it's a great question. Outside of changing the system, which not going to talk about, but certainly can play a role in all of this, is really prioritizing it. We as trainees, we don't have a lot of free time. I understand that, and we are at the mercy of the system and the rigors of training. But you do have options in almost every minute of the day to do something either for yourself, or to either neglect it or choose something that is unhealthy. And I think you don't need to start like big. You don't need to change your whole life in order to incorporate wellness strategies. You need to choose small things one at a time, and they pile up to create a better version of yourself, or to allow you to be the best version of yourself, is what I should say. So I think our curriculum demonstrated that doing small things, like doing one activity in the mindfulness area actually really helped me tremendously, where I would reflect upon the day and write down what went well and what didn't go well. That in and of itself allowed me to decompress in a so much more healthy way than just sit in front of a TV at the end of the day, which we'll all have like 5-10 minutes to do that. You can't tell me that your program is that busy. And instead of doing that, I wrote it down, and I had a chance to reflect. I had a chance to put it in a binder and call it a day if it was a bad thing. I had a chance to look back after a week and realize all the things that I had done well. And the other thing that really helped me was, instead of having a drink and sitting in front of the TV, was to just have a conversation with my wife. And you'd be surprised, like, engaging with another human at the end of the day, and like getting either talking about work or not talking about work allows you to, I don't know, retain a sense of your humanity. I think both of those things, even in extremely busy programs, both of those things and many other things that are small, can have a big impact. And dismissing that, I think, is perhaps where some people can go wrong, or just not knowing that it helps tremendously.
Hugely important messages, Chris. Small changes can lead to big, big, big differences in who you are and the way you feel. And the next thing you know, listen, you've made one small 5-minute change, then it's 2 small 5-minute changes. And then all of a sudden, a year or 2 later, you've made an hour of difference in your day that just makes you feel like a completely different person. And it's a long game. It's not a short-term game. And you said before, you're still working on your wellness. I like to call it a wellness practice, right? Just like people have a mindfulness practice or a yoga practice or a golf practice, right? I mean, you're working on these things on a daily basis. You're never going to be perfect at them, and you're always going to evolve. And I think it's great that how you recognize that those small changes make big differences.
I couldn't agree more. I think this is how, elite athletes do it. And, I think everybody is kind of embracing this growth mindset these days. And I think that this fits right into that.
Yeah, absolutely. So tell us now, you're finishing up your lab year in fellowship. You're heading into clinical year. Obviously, huge transitions from residency to a research year to a clinical year. Nuts and bolts, how have you managed your wellness, and what's the plan for being clinically busy up in Boston?
Well, I couldn't go without saying it's 2 lab years in Boston.
Oh, 2 lab years. That's right.
We love our lab. So to be honest with you, it's hard. These transitions are hard, and I'll be, again, the first to admit that I don't have it all figured out. Creates a lot of anxiety for me. But one thing that I've realized thus far is that I know that I am going to work extremely hard, and I am going to grow clinically, and likely going to do well when it comes to the metrics of how I'm going to be graded upon by the faculty based upon prior performance. And I think a lot of people would think that about themselves too. But one thing I know could happen is that I could get so sucked in and so distracted about my own personal health that I'm going to become somebody that I don't want to become, much like residency. So when I think about these transitions, I really do prioritize my own health and making sure that I'm getting practice again. I'm practicing these small strategies. During the lab year, I had the luxury of sleeping in. I didn't have to get up at 4 o'clock to be at the hospital by 5. I could get in the lab by 7, 8, 9 even. And I had the luxury of just having the option of sleeping 7 hours or more. Now I need to prioritize that. Now I need to think about like mindfulness actively. I need to think about using those 5 minutes at the end of the day to have a good conversation with my wife, even though I'm going to be very tired, because I know that it's going to help. So I think really knowing that you're going to need to prioritize these things and start practicing before you transition. And being okay, honestly, with little failures along the way, but be kind to yourself, I think is another thing I tell myself during these transitions. You're not gonna get it all right away, but it's not acceptable for your own health and for the health of your patients to not prioritize yourself.
Yeah, a couple great points. I just want to reflect back to the audience because I think they're so important to hear. Is anytime you're going through a transition, you think about kind of the ideal and where you want things to go and where they can go, but anticipating what can go wrong actually does a ton to reduce anxiety and get you prepared for things when they don't go perfect. And I think that's the other great point you bring up, that failures are going to happen. It's okay. Give yourself grace, give yourself kindness, and recognize you're not going to be perfect every minute of every day, but being prepared for when things aren't perfect is a huge step in anxiety reduction, but also preparation for success. And I think that's an important message for people to think about. And then the last part of this is being active, right? Recognizing that you're no longer, once again, your life is going to become less controlled by you. You're going to become more of the whim of the kind of operating room schedule and your training schedule. But you may need to be a little more active in the things that make you whole and the things that make you well. And that's part of mindfulness. Mindfulness is not just being in the moment, but it's intentionally doing it and purposefully doing it. And I think that's a great point you bring for the people listening.
Yeah, yeah. And one thing I didn't mention, I think is especially important is to lean on your support system. And I think within that is engaging with mentors, actively engaging with mentors. And I'm not talking necessarily clinical mentors. Obviously, there's a place for that in growing clinically, but I think that there's equally, if not more important, place to continue to grow personally and to make sure that somebody is there to check in with you. For me, I find a lot of support from my wife, but I also lean on that urologic oncologist that was my mentor back at Ohio State, even though I'm not doing urologic oncology and I'm in Boston. And hopefully others have found people in academic medicine along the way who can serve that role at their institution or outside of it. I think a lot of faculty would love to be in that position and understand its importance. And I think it's in these transition moments, especially, I think that leaning on your support system, especially mentors, is vital.
Yeah, I love the term stakeholders because it implies kind of a two-way relationship where they can help you make decisions when you're struggling. There's somebody you can rely on, but they also hold you accountable. So whether it's your wife or your surgical mentor or your mentor from Ohio State, you say, listen, I set these goals for myself, X, Y, and Z. Am I living up to those expectations? And a good stakeholder or a good mentor is going to tell you yes, no, or somewhere in between. These are the things that you can do better, and these are where you're falling short, which is hugely important to get somebody honest on your team who's going to tell you when you're falling short.
Yeah, couldn't agree more. Couldn't agree more.
Yeah. So, July is going to come around real quick. What's the strategy for the day? You've obviously created a wonderful routine for yourself. You seem like you're in a pretty good space. How, nuts and bolts, what's your strategy for maintaining that wellness?
Yeah, as I've alluded to before, I think wellness can come from a variety of different domains. But for me, my strategy is really just in a couple domains. I need exercise in order to maintain some level of physiologic support for what I'm about to do and what I know is coming in surgery. So for me, that is running. I run a couple times a week, so I have to carve out some time. And for me, one of those runs will be on the weekend when there's usually more time, and one of those runs has to happen during the week. So that's the bare minimum. And I know physiologically that makes sense for my body. But honestly, the most important thing that I do every day is I journal and I talk to my wife. And I think these two things are, vital for me to keep things going. The journaling especially provides closure to some things that went poorly. It allows me to reflect and allows me to see successes in real time. And, even if it's small wins, even if it's things that, in the moment when I'm writing them down seem like minuscule, when they add up over time, when you look back at them, you realize that you've done quite a bit of good, which, in dark times can be quite helpful. And then keeping up that relationship with my wife, I think is is especially important for me because she is my support system. You know, we're Midwesterners living in Boston, and it's just us two. So, you know, for us, that's incredibly important. I'm adding a character into our life. We're getting a puppy. So it may not be the best timing to get a puppy in July, but we're giving it a try. So that could be another strategy.
Puppies and children, there's never a perfect time. There's never a bad time. If it's important to you, you make it happen. It'll work out. I love what you said though, right? You recognize you're not going to be able to focus on all of the domains of health every day. And that's okay too. But you're really parsing down what's important to you. And I always, one of my favorite things to say to people is you can only have one priority. And I think you've identified, kind of your wife and your relationship as a priority. And then you could prioritize things underneath that, right? Your physical health is one big one there for you. And I think it's really important for people to hear. Chris isn't talking about running every day. Chris is talking about running twice a week. That's okay. That's still physical health and working on it. Journaling is a daily activity, but it's also important to recognize I journal, you journal, a lot of people out there do. Not every day are you writing for tens of minutes or hours. Some days it's just brief thoughts, 30 seconds, but you keep that activity up. And then there's days when you sit there and, I can write a couple of pages or more than that, just reflecting on kind of random things that happen throughout the day or things that I want to put down because they're important to me. And I'm sure you have the same experience. So you don't have to do these major things, but identify your priority, talk to your wife, talk to your significant other, and then, identify 2 or 3 things beneath that are really important to your essence. Hugely important message for the audience, Chris.
Yeah, I couldn't agree more. And I've tried, other strategies, and it's not that they don't work, they just don't work as well as these, and they don't fit within my lifestyle, at least as a fellow and as a resident. So this is what's worked for me.
So in a year, you're going to have another transition.
Yeah.
Not getting too far ahead of things, but as you anticipate kind of the transition to faculty, how do you foresee, not to kind of put you on the spot, but you seem pretty good at this. So I'm going to put you on the spot a little bit. If things go ideal in a faculty position, what does it look like? And what are the things you could foresee being issues as you transition from fellowship to faculty?
Yeah, this is something I spend a lot of time thinking about, because it does scare me. I think, not knowing exactly how I'm going to be measured and as far as success and how I'm going to be honestly just compensated and what I need to do in order to keep that position going causes anxiety just in the unknown. But I think a couple of things are important to me when I think about this next step. One is that I don't lose all the strategies that I've gained in training, and that I continue to practice them no matter what. It doesn't necessarily matter if you're on the attending line in the brief op note or in the trainee line. Wellness is important, and I think that we realize that in our pilot, and I've certainly realized that in the multiple institutions I've been at. So continuing on, not throwing away what you've learned, even though the context is different. But I do think, though, when I think about an early career faculty, is trying to be at a place that prioritizes this and recognizes that it is vitally important, because there are significant systems things that can contribute to burnout. And I think one of them is a chair or a leader of a department or a division that just dismisses it entirely. And I don't want to be at a place like that. And don't want to also, play that card with future trainees that had come out of training and enter the department. So I don't know if that answers your question. It's something that I think about a lot. I think the take home is that just don't throw away what you've picked up in training and continue to try to grow. This is a never ending business of trying to get better. It sounds like you've done quite a bit since you become a faculty member, and I anticipate myself continuing to grow in these strategies as a young faculty member. So, I haven't figured everything out. I don't think anybody has, but don't stop training in wellness. is what I guess what the take home message is.
Yeah, I think that's a great message. Our career in surgery should be about 30 years, we hope, right? Some of us will go longer, some of us will go shorter. But even when we're done operating, the wellness practice will continue, right? It will transition onto something else, and that thinking down the road, that could be a really tough transition, right? How do you stop doing something that you've done and loved for 20 or 30 years? But we'll save that question and those thought processes for another time. I love what you talk about, having a supportive department and supportive leadership. How do you think about structuring your week or your day from kind of an ideal wellness standpoint? You're gonna think about your dream job in the next year. You may or may not get it, but let's think about kind of how you would like that dream job structured.
Yeah, I think the dream job would, would honestly a, be at a place where people have the same values and you have wonderful partners who think the same way but also practice wellness themselves, and you can tell what those departments are and how they feel. I think not I don't want to go into specifics of starting off with 30-minute patient encounters as opposed to 15, that kind of thing. I'm sure that probably helps. And to not be so hard on yourself. But I think, being kind to yourself and knowing that, transitions are tough. But but I think the biggest thing for me is to be at a place where I'm going to have support, because, I've recognized in my time that I really do lean on other people in order to get through hard times. And, if I don't have that element there, outside of my wife, then I'm going to have a certain element that creates wellness for me not present. And so I know enough about my own wellness strategies to know that I need to be at a department where this is prioritized and the partners practice it on an active basis and can model it for me and can help me grow.
I think that's a really important thing. It's insightful to who you are and what you need, and recognize too. We each have individual value systems, and we each have individual personalities, and finding the place that fits right for us is hugely important. And the people that work well with us and complement us, I think is hugely important. And it brings us back to where we started a little bit in. That how important culture is. And I just want to highlight, you talked about in your next job or your dream job, having partners that, facilitate a good culture and all this. You changed culture at Ohio State. And you did it in a relatively short period of time. And it wasn't you on an island. I mean, it was incredible leadership and support and co-residents and faculty who wanted to be a part of it too, whether they were included or not. And so if you're in a place, the reason I'm bringing this up is for the people out there who are not in a place where they feel supported or well, that you can be that impetus for change. You can model good behaviors and you can talk about these things. And it may not happen overnight. It may not happen as quickly in your place, but you can make these changes by being kind of the force of good culture.
Yeah. Well, thank you for saying that. That's quite flattering. I certainly could not have done what I did without the incredible influence of Dr. Cheryl Lee at Ohio State. I mean, she talked about changing culture. She did it almost immediately when she stepped on campus, and she was the impetus for this whole thing. So can't take credit for that.
Well, if you don't mind, tell us a little bit about Dr. Lee and her leadership style. How did she do it right away? What was if you remember kind of it doesn't have to be word for word what she said, but kind of how she said things in the beginning to set a tone.
Yeah. Well, she's a person many people know who sets very high expectations for people, but she makes you feel that you can meet those expectations, if not exceed them. And she's also willing to go to bat for you in order to get to that point. But I think one of her biggest strengths as a leader is empowering those underneath her, in this case, myself, to take on a leadership role and create programs and to build something for yourself, but also for the program. And I think a lot of leaders have a very prescriptive way of doing that, or want to do it themselves, always want to be the leader of the ship. And in this case, Dr. Lee empowered me to take control as a resident, as a PGY3. And it was the one thing that was I guess the core defining thing for the residency program for a couple of years, and it was being led by a trainee. And I don't think that would happen in a lot of programs, and that's a testament to how Dr. Lee does things. And couldn't thank her enough for empowering me to do this. And she lit my career to focus on things like wellness and medical education, in large part because of her empowerment.
It's an incredible story and an incredible example for people to hear. Good. So what haven't we covered, Chris? What else do you want to talk about? You know, is there anything I missed or we missed that you think it's important to cover today and that people should hear?
Not in the context of the wellness pilot, but I guess I'm curious. I mean, are you optimistic for the future of burnout and I guess on the flip side, wellness in urology?
I am. By nature, I'm an optimist, but I am incredibly optimistic. And the kind of data I would support to say that is that more and more residency programs are becoming interested in wellness and wellness initiatives. More and more faculty are becoming interested in it. And I'm getting asked to give more lectures on and discussions on wellness and well-being than on kidney cancer or any of the urologic oncology work that I've ever done, which may speak to the quality of the urologic oncology work I've done, but I think it also speaks to the need and the desire around this community and people wanting to feel well. I mean, we're at a critical mass and a critical juncture where people are struggling and we're struggling together, and we can rise out of this together. And creating this community, having these conversations, sharing experiences of good, bad, and how to move forward, I think is what people need and want to hear. And I think it speaks a little bit to why people are listening to us today, right? And I think I am optimistic. That was a long-winded answer to say yes. I'm very optimistic. We're moving in the right direction. You see institutions now, University of Pennsylvania, there's a grant mechanism now for wellness programs, and it's not just yoga and axe throwing and happy hours. No, it's metric defined, objective measures, implementing programs. I think we're going to see some big changes in the future for how we mentor and treat and change our residents and our fellows and our faculty. And this is going to be all going to make us better surgeons, I think, which is hopefully the goal of doing this today.
I also share in your optimism, and on behalf of, I guess I can represent trainees in this instance. I want to thank you for bringing this topic to, not that it wasn't in the light already, but certainly it wasn't in the light enough. So thank you for all that, and certainly wasn't a reflection on your work in urologic oncology.
Debatable, highly debatable. We'll see if the grants roll in for wellness and not for any kidney cancer work. I think the writing's on the wall, but that will be decided in the future. Chris, thank you so much. Just to kind of summarize some of the great things that you said today for our audience, we talked about domains of wellness as you kind of rolled out your program at Ohio State, and how different people are going to have different needs in different domains, and that's going to evolve over time. And that's all okay. That's part of this wellness practice or this wellness evolution that we're all going through. But being purposeful and mindful and thinking about what's important to you is all part of that. I think the other really important message from your pilot study is that you can make change. You can make really big change in a small amount of time with little steps. These weren't kind of complete revamping of the surgical rotation structure in the operating room and the way people interacted. No, this was 10 minutes of exercise, or 3 balanced meals a day, or 7 hours of sleep. I mean, these were little changes that led to big cultural changes in wellness. We talked a lot about transitions too, and I thank you for your insights into that. And I think one of the things important for people to hear is, as you're going through a transition, whether it's into residency, out of residency, into your first job, whatever it may be, think about the ideal, but then also think about your potential pitfalls or what could go wrong. And that will prepare you for when things aren't perfect. And when they're not perfect, and when you experience your first of many failures, give yourself grace, be kind to yourself. And when things are getting tough, whether it's in residency, in training, transition, really focus on your priority kind of domains. And you identified those for us today graciously for yourself. Everybody's going to be different, but you're not going to be able to do everything in every day to be well. But focusing on whether it's your physical health or your personal relationships, mental well-being, whatever it may be, parsing down, identifying what's really important to you and can keep you moving in the right direction, I think is incredibly important. And keeping good strategies was one of the things you said over and over again. So I think that was huge. And I think there's a lot of people who are going to benefit from our conversation today, Chris. So thanks for that.
Thank you so much for the opportunity to speak with you and to all your listeners.
Good. Have a wonderful day. Talk to you soon.
Thank you.